The Closing the Gap podcast is produced by the Association of Nigerian Physicians in the Americas and is supported by the association, sponsors, and advertising. Hello, everyone, and welcome to the Closing the Gaps podcast, brought to you by the Association of Nigerian Physicians in the Americas, also known as ANPA. My name is Jason Prater, and I'll be your host for today. Today on our show, Closing the Gaps podcast, brought to you by ANPA. We have an incredible doctor with us, Dr. Ife, and we are excited to allow her to join, to be able to hear her heart, to be able to see what is it that she feels like she is contributing to closing the gap. And so without further ado, enough of me, more of her. So please, doctor, introduce yourself and tell us a little bit about your profession.
Well, thank you, Jason. Hi, all the listeners out there. My name is Dr. Ifeyinwa Osunkwo. And everybody calls me Dr. Ife because in America, they can't pronounce my name. However, I do want to say that my name, Ifeyinwa, means there's nothing as beautiful as a child. And I love my name because I picked a career as a pediatric hematologist, oncologist, and bone marrow transplanter. So the name is quite appropriate.
Very much so.
I'm a professor of medicine and pediatrics. I had a 32-year career as a clinician and investigator and a researcher. And most recently, I joined industry, and I currently work for Nordisk, rare disease, as a chief patient officer. I live in New Jersey, but my role is based out of Zurich. And that particular role is pretty unique. And what it is like I'm the ambassador for the company as a voice for the pharmaceutical company to explain to the population out there, the patients with sickle cell disease, why it's important to participate in research so that we can develop drugs that will help improve their condition. And then I'm the internal conscience of the company to try to help them understand how to develop drugs that are fit for purpose for the population that needs it. So I feel like I live my life on purpose. I have fun every day at work, doing what I love, and I'm glad to be here as your guest.
Okay. So that is so much. First off, doctor, you are doing a whole lot, but I caught one thing, and then I'm going to get into the other stuff, living your life on purpose. And you were talking about everything from helping, sounds like, kids to developing medicine to making sure everything is handled appropriately. And then you're telling us that you're doing it on purpose. I love that. So please, if you wouldn't mind, what do you mean by living it on purpose?
What I mean by living my life on purpose is I believe that we were put on this earth for a reason.
Yes, absolutely.
The best thing you can do is to figure out what it is God put you on earth for, and let that be your day job, your night job, and your fun. Wow. And I happen to have been blessed with the opportunity to realize what I wanted to do, what God put me on earth to do when I was really, really young. When I was 4 years old, I had an anaphylactic reaction to peanuts. And I ended up in the hospital, and I got exposed to healthcare, and I had a wonderful pediatrician. And that began my journey into healthcare. My mom was a nurse. My dad was a medical lab tech. And all my life, I was fascinated by health, medicine, helping people feel better. And I have asthma, and that was a big issue. And I was exposed to healthcare a lot. So I really decided when I was really, really young, I wanted to be a doctor. I wanted to help people, and I wanted to do this in a way that set us apart from everybody else. I wanted to be a doctor that understood the patient and that served the patient and not just myself.
I love that.
Yeah, so I loved medical school. It was so much fun. I actually began my medical career at the age of 13, having done a certificate program as an LPN, a licensed practical nurse. So I was a nerd, like from really, really early in my life. And I knew how to do deliveries and stitches before I even went to medical school. And, you know, it's just been a journey since then. I figured out sickle cell was my passion in medical school, and I trained to be a hematologist. I did pediatrics first and hematology. And I ended up with a career where I was able to take care of people with sickle cell disease from birth until age 21.
Wow.
And then I reinvented myself and began to do adult sickle cell disease. So I did 10 years in an adult program, building a system of care for adults with sickle cell disease. And then I was like, you know what? I think I want to be able to do this on a broader scale to help many more people than what I can see in clinic. And joining industry, instead of taking care of 10, 20 people a week, I can help people in the millions across the world.
Right.
And my focus in my job is sickle cell disease. And so, I'm living my purpose.
Okay. So, doctor, once again, you're just amazing, for one. Okay.
Thank you so much.
Secondly, what I heard was this. So at a young age, as being a younger lady, there was another doctor that helped you.
Yep.
And that birthed a passion in you, right?
Yes.
So if we're talking about closing the gap, this is what I would like to see. If you can encourage a listener, maybe that's in college right now, or somebody who's debating or on the fence, a young lady, hey, is this my passion? To share what that meant to you, to where what you just said right now, trying to help millions. Somebody encouraged you. You saw the heart of another doctor that encouraged you to be where you're at today, to be able to live your life on purpose, to help other people. What if there's another young lady thinking of yourself when you're younger? What would you say to her?
I would say hit me up on LinkedIn and I will talk you off the ledge to make sure you finish what you start. No, I kid you not. I love mentoring people. I've been a part of ANPA for many, many years. And one of the favorite parts of ANPA is the medical students program that happens on Sunday. And I just love letting people hear my story, understand that it's going to be hard. But if you love it, it doesn't matter how hard it is, right? You have to dream. I tell people, I say, you have to dream about what you want and not look at the potential short-term obstacles, but look at the longer-term joy, peace, and satisfaction you get from doing what you love to do. And yes, medicine will kick your butt. Going through the training, residency, fellowship, it's very, very difficult, but you can do it. You don't have to be the smartest person on the block. You have to be the most passionate person on the block. You have to want it more than you want to give up. And if that's you, I'm on LinkedIn. I can't give you my number on the podcast, but if you find me on LinkedIn, I'm the only Osunkwo on LinkedIn, so you can't miss me. I will definitely reach out and support you. I think that there's not enough people talking about the reality of being a physician and a female, being a minority in America, being of immigrant parents in a healthcare system that is truly not designed for us or welcoming to us. I have been through every roadblock in my career that is known to man. From I went to the second class medical school, to being treated like I'm the nurse, I'm the janitor, to being passed over for promotion, to being passed over for opportunities. You have to have grit and tenacity and a tribe of people supporting you. And I'm willing to be that tribe of people helping you to push through to get to where you want to go. But it can be done. It can absolutely be done.
That's right. That's right. And so you're saying a second ago, and sorry, I'm still stuck on it, was just living your life on a purpose. I now kind of want to rephrase that and say you're living your life and your passion on a purpose.
Absolutely.
And so for anybody that's out there that's wanting to be able to help, this doctor is kind of giving you a roadmap and saying, hey, it's not going to be easy, but when you see somebody in need, how can we as a specific individual close that gap? And so you said you've been a member of Association of the Nigerian Physicians for many years, put you a little on the spot. How long do you think that was exactly?
My first ANPA was in 2006. I had just moved to Atlanta to work at Emory, and my sister, again, said, hey, come to Florida. So I'm like, okay. I went to the conference with my husband and my kids, and I had a blast. I think I was so fascinated by seeing so many Nigerian physicians in one place. Because I was working in academia, and I was like the only Nigerian doctor, the only Black physician of color in an entire department. And I was like, okay, this is kind of lonely. So that was my first exposure, and it was amazing. It was absolutely amazing. I missed a couple of years, and then I went back again in 2012, and I think I've gone every single year since then. And I have thoroughly enjoyed. And Nigerians are unique people. We're loud, we're rambunctious. You might think we're fighting when we talk, but we're having fun. You can be yourself, right? When you go to ANPA Congress, you can be yourself. You can just let it out and be who you truly are. Pull back the code shifting and just be yourself, because everybody there understands your experience. They understand what you're going through, what you've been through, what they've been through, and they kind of share and support each other. It's also been an opportunity to give back. I went to medical school in Nigeria, and it was essentially for free. So I have a little bit of a guilt, right? I think if I add up my 6 years of medical school tuition, it can't be up to $200, $300 total. And so I feel like I owe an obligation to Nigeria and Nigerians to give something back to them for the wonderful education they gave me, to the fact that I'm one of the, no shade, leading sickle cell experts in the country and in the world. I think I should give back to Nigeria, which is the country that has a high sickle cell disease prevalence in the world. And so I really love that ANPA gives you a platform and a portal to be able to give back to the society that, pretty much invested in me and helped me become who I am.
That's huge. And I love it. And I think that's so awesome. And once again, just your passion. And I hope listeners, y'all are listening to this doctor, her passion, figuring it out, dealing with the grit, dealing with the hardships, but saying, you know what? Nothing will stop me. I'll be there to help. And so real quick, one last question, if I may ask you, doctor, what is a goal that you think that you have for your future where you think you can help to continue to close the gap?
So my biggest dream when I decided to go into medicine at the age of 13, I had a dream that I was going to one day help transform care for people living with sickle cell disease in Nigeria. That was my dream. I met this guy when I was in medical school. His name was Uche, and he had sickle cell disease. And literally, we grew up together. And when I graduated in 1993, December, he passed away. I think in 1995, I finished my internship. December, he passed away. I had just come back to the States, and he passed away. And I swore that was going to be a motivation for me to help change the outcome for people living with sickle cell disease. I had so many patients die, 4 years old, 5 years old, 6 years old. He was one of the oldest people I had met. He was in his late 20s, early 30s. And I really couldn't believe that after all of that, he still passed away. And so I went into sickle cell disease with the purpose and a determination. And I've done research. I've done clinical trials. I've done program development in sickle cell disease. And I think my current role, where I work for a global pharmaceutical company that has at least 4 to 5 assets under development specifically for sickle cell disease, is part of how I feel my purpose and my passion is going to help close the gap for people living with sickle cell disease in Nigeria. My company has 6 sickle cell clinical trial sites in Nigeria. I've been to Nigeria multiple times in the past 2 years to try to help put this program in place and help implement these trials. And I can't wait for the conclusion of this study to where we can actually have new treatments for many, many, many more people living with this condition in our motherland.
Wow. Dr. Ify, that is literally incredible. And our hearts go out to you that all of these things will be able to be accomplished. And what you're doing, what you've gone through personally, the impact now that you're trying to make, living your life on purpose and with a passion to help close the gap is truly inspirational. And so I want to say thank you so much on behalf of ANPA, Closing the Gap podcast, for being a part of today's show. Ladies and gentlemen, we're going to take a short break, but we'll be back soon. Once again, thank you so much, Dr. Ify.
You are welcome. Thank you. Have a good one.
Have you ever considered plastic surgery? Do you have poor self-image or body pain due to excessive skin or fat? You would consider professional cosmetic plastic surgery provided by Abuja Plastics. Besides concealing aesthetic physical flaws, cosmetic surgery has several physical and mental health benefits, including increasing one's self-worth, self-esteem, and overall quality of life. At Abuja Plastics, we specialize in facial rejuvenation, breast enhancements, and other contouring procedures such as liposuction, tummy tucks, fat transfers, and mommy and daddy makeover. Our office is located at 276A Kofo Aboyomi Street, Victoria Island, Lagos, Nigeria. Visit us online today at www.abujaplastics.com or email us at info@abujaplastics.com. ANPA Closing the Gap podcast listeners can get 5% discount on surgery fees and 10% off spa services when they mention the Closing the Gap podcast. Get your nip and tuck today at Abuja Plastics. M&G Etome Foundation provides skills acquisition programs, graduate HSE programs, and community sports and recreation programs for impoverished youth in the Port Harcourt area of the Niger Delta in Nigeria. Our goal is to break the harsh cycle of poverty in these rural areas of Nigeria by teaching the value of self-empowerment and improvement through our various programs and activities. To find out more about what we do at M&GE Etome Foundation, visit our website at www.mgesolutions.org. We also welcome your donations, support, and sponsorship offers. Together, we can facilitate positive change and programs of sustaining development of youth in the Niger Delta community.
Thank you for staying with us till the end of the show today. This has been the Closing the Gaps podcast, brought to you by the Association of Nigerian Physicians in the Americas, or ANPA. Remember to follow us on Facebook and other social media platforms. Our social media handles are as follows: Facebook, ANPA National; YouTube, ANPA 8415; Instagram, ANPA_National. You can also visit us at www.anpa, that's ANPA.org, for more details about up-and-coming events. Finally, remember to join us next week for our Closing the Gap podcast, where we'll have a whole new set of guests doing amazing things to close the gap and make healthcare services more accessible to people in Nigeria and in the United States. Once again, my name is Jason Prater, and it has been a pleasure being your host today. And until next time, stay healthy and have a fantastic day.